there's a lot of confusion of what to do, what about our careers after we have done a graduation degree in psychology. So I'm Dr. Shruti Verma. I'm an assistant professor at the Behavioral Health Sciences Department at SIU Pune. And we're going to see, we're going to handle what is the gap between the classroom and the career. So when we do the degree, we do have an understanding of the human behavior. We learn a lot. We learn so many theories. But what about the next step? We kind of are there in between of the classroom and the practical career that we are going to have. So this webinar will try to kind of bridge that gap and try to give you an idea of what you can do after this degree, right? So we're going to explore a lot of myths versus realities, a lot of misconceptions about these careers. We're going to see what are the common struggles of the graduates, and we're going to also see what are the emerging pathways and how you can actually build your employability, right? So first, we are going to see what are the different myths versus realities of this career, right? So there is this myth that a psychology degree will automatically qualify me to become a therapist or a counselor. That is, I've seen in my experience, one of the biggest myths. And the reality is to even call ourselves psychologists, we do need a master's degree. And with the commencement with NCHP now, it is all the more clear that to call yourself a psychologist, you do need a master's or an MSc, MA degree in psychology, right? And you also need extensive practical learning, because when it comes to being a therapist or being a counseling psychologist, the practical skills are all the more important because you're dealing with human life, you're dealing with human behavior, right? So just an undergraduate degree is your foundation, is the theoretical foundation, but the practical skills you're going to learn after a master's and even after that. So based on NCHP, which is the National Commission for Allied Healthcare Professionals, these are the job titles that you actually get. So after, as you can see, the bachelor's degree, which is the 4-year bachelor's degree, you will be called as behavioral health counselor, right? With any specializations, which we are going to discuss ahead. What are the various specializations kind of available now? But after the master's, you can call yourself as a behavioral health psychologist, right? So that psychology tag, the psychologist tag will only happen after the master's. And of course, after PhD, you can be an academician, you can be a research psychologist. And after that 2.5-year diploma, you'll be a wellness promoter and not a counselor, right? So these kind of clarifies us very easily. And so we can kind of clarify the myth that we have that after bachelor's we can call ourselves a psychologist. We can't. We can call ourselves a behavioral health counselor. So what often students believe is that even after bachelor's or master's, there is just clinical therapy or HR or just research. But this field is growing a lot. And again, through NCHP, fields like forensic, sports, cyber, military, they have emerged, and they are provided as specializations now in undergraduate. So even we at SIHs are now providing these kind of specializations because we're implementing NCHP now in our programs, in our bachelors. So these are the specializations that you're going to study. So this limited options misconception, I think we can clear now. It's not that with a psychology degree, the options are limited. The field is growing very vastly. And with these specializations, you can choose the career you want, you can choose the field you want. It has become interdisciplinary and multidisciplinary, right? So it's not just therapy and it's not just HR and not just academics. You can you can choose a lot of these specializations being offered, right? Now, one of the, again, the myth or that expectation is that immediate employment. Humko degree milega and we'll go immediately into employment. the the kind of a truth is you do require internships, you do require specialized skills which go beyond your degree. And psychology is a career which requires continuous learning. It takes time, and the practical exposure is something which is very vital in our field, because again, as I said, we are dealing in healthcare, we are allied healthcare professionals. And when it comes to healthcare, the practical exposure is something which is really important, and as equally important as the theoretical foundations you're going to build in your degree, right? So even here at Symbiosis, we offer a lot of observerships, internships, clinical postings in the Symbiosis Hospital itself. So we do focus on this because these practical learnings, they do build your career. And of course, that immediate employment expectation is somewhat a lot of times broken, because you do need additional internships. So it won't be like कि तुरंत job मिल जाएगा, but yes, if you kind of build on the internships and the certifications, yes, the employment will come, definitely come. Yeah. So what we are going to see next is why do graduates struggle with direction, right? Because we have to see the hidden problems in the traditional psychology education that we go through. The first and the most important thing is the theory practice divide, right? A lot of theories we learn, even in a lot of people here, I think they are in their bachelor's program, and we do learn theories, cognitive theories, developmental stages, and all of that. And yes, they are required for the foundation of the practice. But then, how do we practice it? When we sit in front of the client, how do we apply these theories? We cannot just teach the client, right? वो क्लास में नहीं आया है, वो आपसे काउंसलिंग लेने आया है, वो आपसे थेरेपी लेने आया है. So how do we practically apply these theories? How do we practically, even if you go into research, how do you practically apply the research methodologies? So all of these, the theory practice divide is something which is the most important gap. And I think this is what you should address when you are going into the field, right? This is what you have to work on. So four core gaps that we see in like the traditional model is first the limited practical exposure, then insufficient career guidance, minimal skill development, and unclear specialization options. So nowadays, with the introduction of NCHP, these are the gaps which are being addressed right now. Limited practical exposure is being addressed by our institute also. We have tie-ups with NGOs, we have tie-ups with rehab centers. So you go to internships, you go to field trips, you even go to observerships, and we have collaborations. So that the field work kind of trains you on how to deal with the real world with the psychology degree. And we have a lot of expert faculties here, expert teachers here. Like we have Dr. Girja here, who is our head of the department, and she is a psychiatrist, and she has so much experience. And we also have Dr. Meenakshi, and so many, I think I should say multidisciplinary faculties here who have a lot of expertise and a lot of guidance to provide you, right? So the career guidance also is, given here. And minimal skill development, so what I mean is the practical skills which are required to take an effective session, or a skill which is required to actually deal with the patient is a lot of times missing, because in theoretical classes you don't really learn how to talk to the client, right? And that kind of skill development is I should say developed through internships and observerships, through practical exposure, right? And of course the unclear specialization options, uh, there is a lot of times very little guidance on how what to choose except clinical counseling and HR. Those are the basic options which you go for. But now, as I've discussed before also, we have so many options. So there will be like a variety of choices for you, and you can choose according to your expertise and according to your inclination. So that way we can guide you, right? So these gaps now being addressed, I think it will help a lot of psychology graduates to go in a career which they want and to go in the career which they desire, right? And again, one of the major gap is the confidence crisis. A lot of people in our field, they don't really feel ready after the degree to take on clients. A lot of times we feel, okay, we have gotten the degree, okay, I've gotten the master's. Yes, I'm a psychologist now, technically, but then am I confident to take on the sessions or to take on the research? So this again is very much related to the theory and practical gap which we discussed before. We have to break this cycle, right? The readiness to work with the clients and this uncertainty behind this readiness, it often delays your entry in the career. And हम कई बार वेस्ट कर देते हैं स्पेशलाइज्ड एजुकेशन के years in kind of figuring out what to do because we don't have that confidence. And to build that confidence, yes, you will need exposure in your graduation and post graduation as well, right? So what are the emerging career pathways that you do take and that you can take now? First of all, the digital mental health, right? You nowadays, a lot of people have their practice online, the tele mental health, or we call it digital mental health, online counseling specialists, digital therapeutic coordinators. And even if you go beyond therapy and counseling, UX, UI researchers, and health in the for health tech companies, there are so many options now with the digitization of the field. And I know it's a double edged sword. The digitization of our field has gotten us in a lot of trouble as well. But yes, the introduction of technology and the intersection of technology and psychology, they are creating entirely new pathways. And with the new specializations coming around, I think digital mental health, it's kind of a revolution for us. Uh, Digital platforms, mental health apps. Even in India, if we see mental health apps like Mitsu and Visa, they are helping people across the globe through digitization, right? So this is also one of the options for you if you don't want to have a physical like practice per se. You can have a digital practice. I think this is one of the I think the most convenient options that a person can get, right? And of course, expanding opportunities are across sectors. Corporate well-being is something which is being discussed a lot nowadays in companies because we are seeing so much of health crises in corporate sector. We are seeing the increase of suicide rates. And because of that, corporate well-being is something which is being discussed a lot. So designing EAP programs, your degrees in organizational psychology, workplace mental health initiatives. And all of this is given a lot of importance nowadays. Then, of course, educational psychology, community mental health, forensic psychology, all of these are emerging fields and they're expanding at a rapid rate. So, again, I'll repeat myself that it's not like you have limited options. You have so many options once you graduate or you do a postgraduate degree in psychology, right? So what NCHP tells you is also that I'm going to discuss in the coming slides that there are some things which you can do and there are some roles which you can work in even after your graduation if you don't decide to do a post graduation. But and there are interdisciplinary roles, right? So you can be a data analyst, psychology consultant, UX researcher, sports psychologist. Like we also have a course on sports psychology. We do take students to stadiums where there are sports psychologists. They see how the sports psychologist works, right? So there are interdisciplinary roles are on the rise now. There are different fields combining with psychology, and even there is media psychology. People are using psychology to kind of analyze films to make more mindful representations of psychology in the film industry or the TV or the web series. And yes, it's been on the rise. And there's again, there's growth in the demand for clinical services, corporate wellness. Most of what is digital health. school psychology as well. Yeah. So, how to build your employability? So, first of all, it's the applied skills, as I said. Applied skills is what's is something which you should focus on since the start of your degree, and you have to start trying to develop your expertise in assessment tools or maybe different intervention techniques, doing genuine certification courses in different techniques like CBT or DBT or REBT, any technique which you resonate with, right? How to practically do a case documentation, how to practically assess, right? You can take a lot of certifications and you can learn where there are hands-on competencies, right? Because purely academic credentials cannot help you, I should say, succeed in the field, right? You do need that practical exposure and you do need that practical training, right? And these are, I think, it's not an exhaustive list, but these are the essential skill categories that you should have. Clinical competencies, obviously, if you want to go into the therapy zone, if you want to start your practice, clinical competency is something you should have. Research capabilities, I'll always say psychologists do need research capabilities because even if you're not an academician, you should be able to differentiate between what is an evidence-based approach and a good researched approach and something which is not scientifically proven. And you should be able to differentiate between the two. So the research capabilities is something which everyone should know, everyone should get their expertise on. And professional skills, obviously, the ethical practice, interdisciplinary collaboration. Yes, you do need that. Even I'll add something here, which is networking, which is much needed in our field. And of course, with the rise of digitization in our field, technology proficiency is something which you should work on. So again, as I say, this is not an exhaustive list, but these are the skills which kind of are essential for, I should say, your survival in the field, right? And that's what I was talking about. Why this research exposure matters. This is not just for the academic exercises. Doing research will develop your critical thinking and analytical skills. And in our field, it is very much required that we use evidence based approaches and evidence based decision making. There is so much misconception. There are so many myths. There are so many, I should say, fake approaches to therapy, and they are not very scientifically proven, and still they are being used because there is no awareness around it. And once you develop the research expertise or the research exposure, I think you'll be very easily able to differentiate between the two, right? And you will use evidence based practices, which is, I think, the utmost importance in today's uh, environment where we see so many hoaxes, where we see so many people just using the name of psychology and doing whatnot. I will not go into that, but yes, we do need evidence based practices in our field, and research exposure will definitely help in that, right? Interdisciplinary training can also help you. If you have trainings in sociology or neuroscience or public health, all of these things kind of combine to enhance your own knowledge on how to practice better as a psychologist. It cannot exist in isolation. Psychology is a field where every other field can impact this field, right? And exposure to these related field will kind of expand your perspective also and expand your career possibilities, right? So being trained and learning through the journey, right? Learning should not stop in our field. I always say this, I still say this for myself, that I've not stopped learning. I'll keep on learning new things. I'll keep on getting trainings in variety of fields. And I think this is what makes our field interesting. Because psychology, again, I'll repeat, it cannot exist in isolation. If you have this kind of interdisciplinary training, it will definitely help you in exceeding in your career, right? So, what are the practical steps to kind of stand out in the field, right? You have to focus on securing quality internships. And I think at our institute at SIHS, we have these clinical postings, we have the types with the NGOs and different centers, rehab centers. So we do provide that exposure to internships and observerships, right? And again, as I said, we have to pursue targeted certifications. So different therapeutic approaches and specialized areas like trauma and addiction. Trauma informed therapy is something which is really needed nowadays. So getting certifications in that and kind of knowing which certification is genuine. So how to kind of decide which certification is genuine and which is a hoax. This is also something which we should get awareness on. You have to check the credentials of the people who are giving you the certifications. A lot of times, people who are not eligible to give the certifications, they are doing these online certifications, and which is really not good for us. So, kind of seeing the distinct difference between the hoax certifications and the genuine certifications, right? And as I said, building professional networks. You have to like attend conferences, participate in workshops, so that you have like a network of psychologists to guide you. It will also help you in getting supervision. It will help you in getting a lot of, I should say, interdisciplinary knowledge again, right? And yes, specialized knowledge. So with NCHP, we have specializations in bachelor itself, and then in masters, will you do have specializations. So yes, build your niche, build your specialization in the field which you want. I think that is what will help you in stand out in the field and kind of exceed in the field, right? So I think a lot of you have already like done your bachelor's or in your final stages of bachelor's. So how to choose what is the next academic steps, right? So after bachelor's, of course, now according to NCHP, you are a behavioral health counselor, but after an MA or an MSc or a master's, you can be a behavioral health psychologist, right? So you'll have an advanced research competence, you have specialist roles for you after a master's, right? So you can decide your academic step according to this. If you want to stop at bachelor's, you can be a behavioral health counselor, right? And there are different specialized roles as given in the NCHP document where you can work on. Uh, you can be in the assistance or the entry level roles in a lot of fields, and you can call yourself a behavioral health counselor. But if you want to be a psychologist, you have to do a master's, an MA or an MSc, whatever you prefer, right? So at our university, for example, we kind of provide two specializations, which are health psychology and counseling psychology. So here we can see the difference between the two fields, and health psychology is just a behavior in medical context. So you can get opportunities to work in hospitals, rehab centers, health programs. And with counseling psychologies, you can work with clinics, schools, NGOs, and also private practice with regulations. So I think when you are deciding what you want to do, what kind of a degree you want to have, I think this is the information which you should have with you of what can be the approaches and what can be the work settings you'll be provided with, right? So again, along with these specializations, you will need practical exposure, you will need the skills, and you will need the extra certifications as well, right? So our field, again, learning doesn't stop in our field, right? Now, whenever you enroll in a master's program or in any program, please ask these three questions every time, wherever you want to attend your master's. Does the program offer substantial supervised practical training? Is the curriculum updated to reflect the current practice, like with the NCHP introduction? Is the curriculum following that? And what is the program's licensing and accreditation status? So, for example, at our institute, we are implementing NCHP now, and even NCHP chairman has also visited our institute, and she was very happy with the curriculum. So we are on point with the current practice, right, which is being going on. But anywhere you want to apply, you have to ask these three questions before you enroll into a master's program or an advanced academic program, right? So I hope I have given you like a brief idea of what things you should keep in mind when you, uh, I think, step out of your graduation. And yes, thank you so much for that patient listening. And now I'll stop speaking. I think you guys can start speaking, and we are open for questions. So, yes, do we have any questions?
We have a question in the chat. Uh,
Okay.
so they want to know about the scope and career opportunities after pursuing. They don't have a background in psychology, but they're pursuing their master's in
Mhm.
applied psychology. They want to
Okay.
know what awaits them in this line of work.
Okay, so Gia, I think, yeah. So Gia, I think with the masters in applied psychology, yeah. So with the masters in applied psychology, you can again go for the I think job roles in hospitals and even your private practice. And of course, you can call yourself a psychologist because you do have a master's. So you can again the kind of jobs that we discussed in that slide before. All the job roles in clinics or in hospitals or in NGOs or even your private practice that you can do, and yes, you're eligible to do that. Any more
Hello.
questions?
Hello. Good morning, ma'am.
Yeah, good morning.
Actually, so various universities. My name is Dr. Surinder Singh.
Yes, hello,
Various
sir.
universities providing the psychology courses there. So I
Mm-hmm.
want to know about the actually when we come on the mental health, we discuss about the mental health. So
Mm-hmm.
mental health is very broad spectrum nowadays, and I think so that every field it is having the problems and issues.
Mm-hmm.
So, but still, the expertise psychologists are lack of expertise psychologists are there because
Mm-hmm.
people have the MA, MSc, PhD degree problem, all the qualification, but still
Mm-hmm.
the skills which are required to handle the mental health issues are not up to the master there.
Mm-hmm.
So, is there any relevant training programs are there concerned with this
Mm-hmm.
mental?
Okay. So I think, yeah, Dr. Savinder, I think, as I said in my presentation, for the practical skills, we do need internships and observerships. We do need that practical exposure. I think a lot of programs have the lack of those, and a lot of times students are not trained in internships and how to actually deal with the clients. So I think factors like clinical postings or factors like observerships are really like much needed in our field. I think that is the major gap here. That's why I discussed this in my presentation as well. And I think that is what we are focusing on our course as well. That we focus a lot, we give a weightage, a high weightage to clinical posting because the students do interact with the patients and they do learn the skills which are actually needed when we are conducting sessions, right? So that practical exposure is something which is, I agree, it's a huge gap. And that is what we are trying to bridge with our course.
Okay, ma'am, what is the difference between MSc or MA in behavior science and
Hmm.
MA and MSc in clinical psychology? Is there
Hmm.
no different segments are there or it is similar are
Hmm.
there?
Okay, so I think if Girja ma'am can, I think, better answer this question. So Dr. Girja, she is our head of the department. So I think she can better answer this question.
Yeah.
Yeah.
Thank you, Shruti, for that wonderful presentation.
Thank you, ma'am.
And sir, to answer your question, I think when we talk about clinical psychology, we are talking about a clinical specialization where we are teaching students about diagnosis, diagnosing specific mental health conditions. So we are talking about more about pathology, and we are talking about diagnosing and therapeutic interventions more specific to mental illness rather than the whole spectrum of mental health. But when we talk about behavioral health sciences, we are covering a more broader domain where we are covering entire spectrum of mental health, uh, covering disorders, distress, and even how we can enhance mental well-being. Talking about the aspects of positive psychology, how we can incorporate that in an individual to enhance their overall well-being is how I would describe a behavioral health science domain. In our the masters that we are offering here at SIHS, we are offering two specializations. So in the first year, they will do foundational courses, but in the second year, they will specialize because now it's a master's program. At the end of their degree, they do need to be able to understand what job roles and career choices they can pursue after completing their masters. So we are offering two specializations, counseling psychology and health psychology. The reason we are specifically offering these two specializations is as a counseling psychologist, again, you are a broader professional where you can work in different sorts of industry like corporate, schools, research institutes, NGOs, educational institutes, and health psychology, particularly. Why? Because we do have a medical college and a 900-bedded hospital here at Symbiosis University, Loveday campus, and that offers them good experiential learning. In fact, I would be happy to share that even our bachelor students do clinical postings in not just psychiatry. They are posted in medicine OPD, they are posted in cancer OPD, cancer daycare, chemotherapy centers, dialysis centers, intensive care units, because mental health is integral to overall health and overall well-being. Therefore, students need to understand how it intersects with other health dimensions as well, and how bringing in the components of health psychology, you can actually improve the approach of a patient towards their treatment, as well as how a doctor can better support the patient in their recovery and in their and overall provide a supportive environment to the patient to promote recovery, and also promote healthy lifestyles to prevent illness from occurring in the first place. So I hope I've answered your question.
Yes, ma'am. I want to know about the licensing practice and legal aspect of psychology part is there because a number of psychologists and counselor are there, na? They are doing the practices are there. If you see this,
Correct.
other aspect that for legal aspects and licensing should be there,
Hmm.
na? When we
Yes,
come in the medical practices, so everyone should be licensing have
absolutely.
and they have the experience and expertise also. So
Yes.
so in that aspect, uh, which course is more suitable for that?
Correct.
Uh,
So up till now, sir, for the only licensing agency that was available in India was the Rehab Council of India, known as RCI, which was licensing only the clinical psychologists who have done MPhil from an RCI registered institute. Okay, so students who had completed their masters in clinical psychology and then pursued an MPhil, which offers the clinical internships in health in tertiary care hospitals, would be registered under the RCIS clinical psychologist. But that left a large number of psychologists who were just practicing on your own, as you said, without having a certified license, and which created doubts about their ethics. Therefore, now the NCHP Act, the National Council of Allied and Healthcare Professions Act, there is a website, sir, you can refer to that, which now will be licensing all other psychologists other than clinical psychologists who under this act. So they have specified the curriculum for the bachelor's program, which we are implementing here at SIHS now from this year 2026. The master's curriculum is yet to be launched by the commission, but we are anticipating that the curriculum will be there by 2027. And only the students who are graduating from institutes which are offering this curriculum only will be licensed under this act. And therefore, as you rightly said, in an area like healthcare, of course, we need students who are licensed and who are, being supervised by a registering body to ensure that the utmost ethics, values, and professional knowledge and skill is present to demonstrate their, skill set.
Any PG diploma in clinical psychology or concern that have any in symbiosis?
So all diploma programs, sir, have now been, in fact, under the commission and NCHP, they have actually stopped all the diploma programs because, again, as I said, people are doing these short courses, 1-year courses, certificate courses, and calling themselves psychologists, which is becoming a problem in the country. Therefore, as a blanket rule, they have banned all the diploma programs. Only the 4-year bachelor's degree program, followed by a 1-year master's program, or a 3 years bachelor's degree program with a 2 years master's program will now be eligible to be licensed under the Act. With RCI also, they have come up with their guidelines, and RCI is also talking about having a basic bachelor's degree in psychology. If the students have done a 3 years degree program, they need to do a 1 year's bridge course to be eligible to do their master's in clinical psychology. They have stopped the MPhil program altogether, and that has come from UGC. That UGC has now stopped the MPhil program. So it will now, that MPhil will get integrated within the M clinical psychology, where the students will be expected to do practical learning. The program itself will have details about what sort of internships and clinical exposure the students need to have to be able to become clinical psychologists. There is also, I think, some doctorate in psychology, which RCI has launched. So I would request you to look up all these websites, the RCI website as well as the NCHP website, which will help you to understand this in more depth.
Hello, ma'am.
Yeah.
Ma'am, I feel that there are many opportunities in psychology, but I am confused about where to start my work. Like, I am from Charkhi Dadri, Haryana, okay, and currently pursuing masters in psychology, in applied psychology, और वो भी राजस्थान से है. तो after मतलब even after studying this subject, I am still not clear about the exact direction or place from where I should begin my career or practical work.
Sorry, what's your name?
Jia.
I think Jia.
Jia. Okay. So Jia, what are you currently doing? You said you're pursuing your master's
Yes, ma'am.
in applied psychology.
Yes, ma'am.
Right. And does your program offer internships or any clinical exposure?
No, ma'am.
So see, that is the shortcoming then of the program, because unless you have a practical exposure, it is nearly impossible to develop the skill set which is required to become a psychologist in order to practice. Therefore, I would strongly encourage you to do your internships either during the break period, summers, or post your masters to pursue your internship in different areas. So again, I don't know in your applied psychology course what sort of courses or specializations they're offering, and what is your passion? Where does your passion lie? right? So you could, as I said, any age group, any and every age group requires counseling and mental health interventions, right? Whether we are talking about illness or whether we are talking about promotive preventive aspects related to mental health. Depending on where your passion lies, you should choose your internships and you should choose to work with certain professionals who are working in that domain. A good 6 months of exposure will give you a good understanding of whether this is what you want to do. Or then there is other pathway where you can do your PhD, get into teaching profession, and become a psychology teacher in any of the colleges. It would largely depend on what you want to do, Gia, and uh, uh, and then take it from there.
Ma'am, as of now, actually, I want to earn money also.
Of course.
Yeah,
So, uh, and I always feel that money follows, uh, your passion. Uh, if you're passionate and if you're good in your work, money will follow automatically. So I would say work right now on building your skill set and start small. By starting doing internships, you will get an understanding of where you are in that in terms of your skill set, and that will help you to start your practice. If you want to start earning, then in some are even paid internships where you can actually get paid a small stipend to start off with, and then
yeah,
you can start off with your private practice and gradually get supervision, say from some senior, to ensure that the work that you're doing is ethical and it's appropriate and evidence based. And then I'm sure you will be able to find your feet.
yeah, ma'am. But I didn't know about where to start, like exact place.
You can come to Pune and work with us. We offer internships. You can look up our website. I'll put it up in the chat box. We do offer
Okay,
internships.
okay, ma'am.
Yeah. We can offer internships to you, and right now we don't have any job openings, but if there are any after you complete your masters, you can even apply for jobs here.
Thank you so much, ma'am.
Okay, I think we have one more question from Aadhar Financial Tech Services. They have raised their hands.
Mm-hmm.
Hello.
Yes, sir.
Yes, sir.
Okay, this is question regarding suppose a student who is pursuing 4 year undergraduate program BA in psychology.
Mm-hmm.
So, and if the candidate is interested to work in having more practice in the field of mental well-being from, uh, and family therapy uh, kind of counseling segment. Then, what master's course is suitable from your university?
Right. So just to clarify and to see if I've understood you correctly, sir, you are saying that somebody is pursuing bachelor's 4-year degree program in psychology, BA in psychology,
Yeah,
and if they want to gain practical experience and especially in family therapy,
and
with
mental
sort of
well-being.
sorry,
Mental well-being.
mental well-being, right?
Yeah.
Then what sort of a master's program should they be opting for, and what Symbiosis offers?
Yeah.
Right. So as I said, definitely choosing a field like counseling psychology, which would be a broader domain, where promotive preventive aspects would also be uh, the focus of study, and also we are offering the masters in behavioral health sciences, which essentially, again, as I said, is a broader domain where we are teaching you right from promotive preventive aspects to curative. So we are even giving, because I feel that as a psychologist, when clients come to you, they don't tell you I want preventive, promotive, or I've got illness or I don't have illness. So as a
Yeah.
psychologist, one should be able to recognize mental illness. They may not be able to diagnose as per the DSM-5 or the classification systems, but they should be definitely be able to recognize the mild, moderate, severe cases. They need to know whom to refer to in case they identify these clients in the community, and they should be able to do basic crisis intervention and risk management, irrespective of whichever specialization they do. And this is what we are training our students through our bachelor's and master's program in behavioral health sciences. Uh, Family therapy is a specific type of psychotherapy, which, depending on the field of specialization that you choose, you may not get, again, in a master's program, it is more broader training where you'll have training in different types of therapies. If you want to specifically learn family therapy, then there are different certificate programs or courses offered in family therapy, either online or offline. Symbiosis is currently not offering any course in family therapy, but through our MSc in behavioral health sciences, we do cover all the aspects of under psychology, and then students are able to choose their specialization in health or counseling psychology in their second year.
Okay, and as far as registration and regulation is concerned, so a candidate who has completed 4 years BA of psychology program, then can he start to practice
So-
in this field of mental well-being and this family therapy? And what kind of registration or RCI registration is required?
So currently, RCI does not register BA psychology candidates. NCHP will possibly be the registering body, sir. They will be
Okay.
opening their, we were told by the chairperson that the registration portal would be opening in the near future. So please look out the NCHP website. What they will do is for all the candidates who have done their psychology degree, right, who have not followed the curriculum of NCHP, they will provide you with provisional registration, and there will be a bridge course that will come up on their website as well for you to get the permanent registration. But the rule of the land, the law of the land will be that only a person who is licensed will be allowed to practice in India. That is going to eventually become the law of the land.
Lessons from NCHP.
Sorry?
Lessons from the National Commission.
Yes. This is the law of the land from the government of India.
Do you have any plan? Does your university has any plan to launch any certification course on this family therapy and mental well-being kind of specialization?
Yeah, so currently we are focusing on ensuring that we comply with the licensing board, the body, and ensuring that we are aligning with the NCHP so that our students get registered. And certainly we'll take your suggestions, sir. I think family therapy is something which I think is very much needed in our country, given the rise in mental health issues among the children and the broken families that we're seeing around. I think that's the need of the hour. Certainly we'll take your suggestion and come up with a certificate program in family therapy.
Thank you.
I think, okay, we have one more question from Piyush. Piyush, please go ahead. Okay, I think he has put the question in the chat, ma'am.
What monthly or annual pay can I expect in this field, whether in practice or in job? Oh, I wish I had an answer for you, Piyush. Unfortunately, there are no standardized pay scales. It all depends on the location. It depends on the institute, organization, the kind of role you're doing, the kind of expertise you bring in, your employer. There are so many factors that will determine your pay scale. Can I, being from commerce background, pursue masters directly, or will I have to do bachelor's first? If you will have to have a bachelor's in psychology, Piyush, for you to be able to pursue a master's in psychology or behavioral health science for that matter. Because unless you have a foundation in psychology, it will be hard for you to grasp. Master's means it's already a little advanced level that you're going to learn. and therefore having that foundation in psychology would be important. If I want to pursue masters directly from abroad, what's the route to it? You can look up the various universities that offer master's program in psychology. Australia, UK, all of them. King's College London, UCL. Or you can look up their websites. They will provide you with the eligibility. And usually their master's programs are 1-year program, and I would suggest you look up the websites of the universities that you're looking for abroad. Accordingly, the website will guide you. I think it's too broad a question for me to answer here. It's legitimate and helpful for developing my skills. There are so many options around. I agree. I think online certifications, who should be doing? For people who've completed their masters should go in for online certifications. That is just to enhance your skill set. But the basic foundation remains bachelor's and master's degree. You cannot bypass that and just do an online certificate course. You will risk being not licensed, and therefore not, that won't be an ethical practice to pursue. So my suggestion would be, if you've only done a bachelor's and master's, look for certifications. Yes, there are, some of the standard platforms would be Coursera. Coursera is one good platform. Even Udemy to a certain extent is not bad. But ensure that it's just not theoretical. There is some practical component to it, which ensures that you have your knowledge skill base adequate for practice.
Ma'am, one thing I would like to add
Right.
here, that
Okay.
online certifications from, I think, if you know from LinkedIn, Dr. Chinu Agrawal, she has an institute, Feeling Minds. So she offers a lot of certifications courses which are really in depth, and they do offer practical component too. A lot of them are offline as well to introduce the practical component. So I think you can go for them also. And online also, she provides a lot of practical knowledge and practical exposures. So if you are looking towards the online certifications, again, as ma'am said, after masters, to get some extra skills, you can go for those courses as well.
Can you please repeat the name of the institute for Miss?
Name of the organization, it's Feeling
Yeah.
Minds, run by Dr. Chino Agrawal. Feeling Minds.
Feeling Minds. Okay.
Ma'am, I would like to know about the AI role in psychology. So, is there any particular software or applications? So, because of mental health is very personal sensitive issues there, na? So we can't disclose to anyone to everywhere to counselors, na? So what are personals going on out there in the life? So is there any application or any software through which we can open-ending questions or maybe something like that, because you are belonging specialize this field in the psychology. So AI based is something solution are available in the psychology.
So, sir, I think my experience here is that I think your question is how to does mental health apps using AI, are they helpful in the field of psychology?
Yeah, is there
Yeah.
any application available? Because
Huh.
some applications by application is available to diagnose the disease or what type of
Huh.
illness is there in the mental field, mental health field. Is there any application AI psychologist like that application will be there? No, we can open-ending questions are there in
Okay.
the application like that.
Yeah,
No,
yeah.
certain type.
Got it. Got it. So, sir, in my experience, for diagnosing correctly and for giving the treatment correctly, I don't think AI is very, I should say, reliable, because in our field we do need experts to actually diagnose, and a lot of times AI will come up with over diagnosis or misdiagnosis. So according to me, apps can help you with maintaining the mental well-being of you. Like a lot of different apps offer journaling prompts. A lot of health apps offer kind of habit building platforms. But for diagnosing and for treatment, I don't think apps are still there yet. I I don't know about the future, but right now, I don't think mental health apps can diagnose or treat. They should not diagnose or treat. We do need expertise from trained professionals for doing that.
Okay,
Hello,
we
ma'am.
have
Uh,
two more people
Question.
waiting to ask questions. Kavya, you can go first, and then we'll have Vishnu
So
Kumar
I
going
just,
after that.
Yeah.
yeah, sure.
Kavya,
Hello, can you hear me?
yes, Kavya, please go ahead.
Yeah, so I just wanted to know about the internship and training opportunities that the institute provide. So as ma'am
Mm.
said before, they have the hospital to provide internships. So I also wanted to know about in health psychology field. So basically, if somebody wants to pursue sports psychology in like health and sports field somewhere, so do internships themselves, institute themselves provide the internships, or the students have to find it themselves?
Uh, Ma'am, I think you're on mute.
Yeah,
Gija ma'am.
sorry.
Yeah.
Yeah. So thank you, Kavya, for that question. So definitely we help you with a lot of internships, as we have a lot of contacts and MOUs signed with a large number of organizations. But if you do want to do your internship, say in your hometown, you're not in Pune, and we do not have a contact there, then we can help you with getting the internship in form of providing you with a letter of recommendation, or ourselves connecting with the organization there to help you find that internship. So the institute provides full 100% support to students in getting those internships, because as I said, we ourselves consider internships and observerships equivalent to the courses that you're learning through the program. Equal weightage is given to your internships and observerships uh, as much as it is given to the courses that you learn.
Okay, and also is like in the whole course for like so basically I want to pursue masters. So like in whole 2 years, is that
Hmm.
particular months only given for doing the internship? So like sometimes doing
Yes,
internship studying is difficult. So it
correct.
is thing
Yes.
about
So usually it will be your summer breaks that will be devoted to your internships. Apart from that, there will be courses specifically where you are expected to do internship, like a 4 credit internship, which will be there as part of their curriculum. Having said that,
Okay.
we are awaiting the guidelines uh, from NCHP regarding the master's program. Once that comes, we will of course be implementing. But till that time, our program is still valid. We have verified it from the chairperson of NCHP that, whether we can continue to run the master's program that we are currently running,
Mm.
as we don't have clear guidelines from NCHP.
Yeah.
So as of now, we are running our own program, but in the near future, we'll be aligning it with NCHP.
Yeah, sure. Thank you, ma'am.
Welcome.
Yeah, I think Vishnu has a question. Vishnu, can you please go ahead? It's in the chat.
Yes,
Right.
I
So he's
will.
a BDS graduate, currently pursuing online masters in data science to get into digital health. Am I eligible for these programs? Just exploring. So if I understand correctly, you want to do digital health. So I'm not sure why would you want to do a master's in behavioral health sciences? Looks like you have a keen interest in psychology, which is great. So then I would say, just if you want to just build your profile in terms of, having a holistic understanding of health, I think you should be the one going for shorter courses, uh, because you will not be practicing as a psychologist. So it doesn't matter. If you're going to be practicing as a digital health professional, then you should do courses in psychology that will just help you give that understanding of mental health. At the moment, at Symbiosis, we are not offering, but seeing the demand, I think we should think of coming up with shorter courses as well that will help professionals like yourself.
Okay, I
Okay.
think we've had.
Yeah, we had one more question, I think, regarding online certifications. How do I make sure it's legitimate and helpful for developing my skills, since there are so many options around?
Yeah, that question I answered, Shruti. So I
Yeah.
just Yeah.
Yes.
So I think we've had a really engaging webinar
Yes.
this week. We had a
Yeah.
great turnout and we've had great interactions. Before, and thank you, Shruti ma'am and Dr. Girija, for
Thank you.
jumping in and clarifying everyone's doubts. I'd like to take a picture, so if everybody could just turn their cameras on, I'll take a picture and then we can be on our merry way on the Saturday.
Yeah.
Mm, Just a second. Yes, I think we have it.
Okay.
All right. Thank you, everyone.
Thank you so much,
Thank
everyone.
you. Yeah, thanks a lot for joining.